Back here at home, the situation changes daily, and now San Antonio Metro Health has released updated guidelines on quarantining and testing priorities. Here's a look.
Priority 1 is to make sure hospitalized patients are cared for and lessen the risk of spreading the disease within a hospital. It includes hospitalized patients, healthcare workers, and first responders with symptoms, as well as people showing symptoms who work in high-risk, crowded settings like homeless shelters and correctional facilities. Metro Health is categorizing Priority 2 as patients showing symptoms who live in long-term care facilities, people older than 65, and people with underlying conditions and critical infrastructure workers. That would include people who work for SAWS, CPS Energy, the airport, and VIA. This priority system indicates that if enough resources remain, health officials would work to test people in communities with rapidly increasing hospital cases to decrease community spread.
And as for quarantine guidelines, Metro Health says essential workers who have had low risk exposure to COVID-19 are not required to self-quarantine. Low risk is defined as being in the same indoor environment as a person who has the disease but does not meet the definition of close contact. Healthcare providers who have been exposed to the virus are allowed to keep working but should monitor their temperature, wear a face mask, and watch out for symptoms. Metro Health says healthcare providers with prolonged exposure should self-quarantine for 2 weeks. And healthcare workers with any symptoms, regardless of whether exposure is known, they're being asked to stay home from work.